Hello, everyone, and welcome back. We're going to get started with our first policy of the day. First one from Los Angeles, titled Medicaid and Reimagining the Behavioral Health Workforce by the LA Certified Peer Demonstration with Alex Briscoe, Gerard Ruvalbaca, and Lisa Salazar. Apologies for any mispronunciation. I am personally very excited to hear about this. It's a topic that's near and dear to my heart, so without further ado, I'll hand it off to you presenters.
Good morning. Good morning, everyone. It's so good to be here. I'm Lisa Salazar with the City of Los Angeles, here to kick things off. What an amazing opening plenary you all had. So I want to say a couple of things before I hand it off to my colleagues. In the City of Los Angeles, we actually have a Department of Youth Development. It's relatively new. It's only 3 years old. And the department is led by a youth council that serves as an advisory body, not only to our department, but also to the 26 different departments in the city that provide services to young people, the mayor, and the city council. So young people definitely have a seat at the table in Los Angeles. When we stood up the department, we conducted a citywide strategic planning process, just doing what our opening plenary said, and that was asking young people, what do you need? And overwhelmingly, the number one and number two top requests were access to mental health services and jobs. So I worked very closely with my colleague, Gerardo Rubalcaba, and had recently met Alex Briscoe and said, hey, this is what young people are saying they need in Los Angeles. They need access to mental health services. And they said it didn't have to be traditional client therapist, sit down, talk therapy. They were looking for peer-to-peer solutions. They were looking for career pathways into this space. They were looking for alternative forms of mental health. So I'm going to toss it to Gerardo Rubalcaba to introduce himself and talk a little bit about his role. Gerardo?
Good morning, everyone. I am Gerardo Rubalcaba. I'm Assistant General Manager for Workforce Development at the city's Economic and Workforce Development Department. So thank you for the introduction, Lisa. So Lisa and I work very closely together, and we have for, I think, more than a decade now. But in terms of our, my department, we administer the city's, workforce development strategies. In Los Angeles, a big part of our focus for over a decade has really been around working with disconnected youth. So youth that are 16 to 24 that are not engaged in education or employment. A big part of that is, the work that we do is around connecting youth or those youth to different occupations and career opportunities. And so we have a pretty robust work experience program where we provide youth, anywhere between 100 to 1,000 hours of paid work experience. For these youth to really connect them, allow them to explore, different occupations. So this program, again, Lisa mentioned the need in Los Angeles coming out of the pandemic. We know that youth have really faced, a difficult time. Disconnection rates for youth in Los Angeles have grown almost 40% since the pandemic. Now across LA County, we have over 144,000 youth that are not engaged in education or employment. So this program is really critical for us, and that it does two things, as you'll see. One, it allows youth that are interested in the mental health field to explore this career, and we do this, as you'll see, through over 300 hours of paid work experience. But two, it provides a critical service, to our program participants. We have over, 2,500 youth that are enrolled through our different youth programs. And as you'll see, this, really provides a needed, service. So with that, I'll turn it over to Alex to introduce himself and to go through a little bit deeper into what this program is.
Thank you, Gerardo. Thank you, Lisa. I hope everybody can hear me, and it's such a pleasure to be here. Thanks for inviting us to be part of this. Before I start and take you through some of the details of the background and history of the project, I don't need to tell anyone who's here today that it's a uniquely difficult time to be a young person. And that some of the things we're doing as a culture to try to address it may not be the right way. So I'd like to just begin by giving a little bit of context about what actually is happening. I guess I should also begin with a little bit of an introduction. My name is Alex. I'm basically, I'm a Medicaid guy. I grew up in my career as a therapist in the Oakland Public Schools. And then I worked at the Children's Hospital Research Center at Oakland with very high acuity youth and young people. And then I worked as a therapist in juvenile detention and foster care. And then eventually I led a large health system in California. And one of the things that always struck me about youth mental health was how amazing young people are and how extraordinary they are at healing themselves. But they lived in a pretty toxic culture. And this data that you're seeing here is that mental health and substance abuse disorders, what we sometimes call behavioral health, by linking mental health and drug and alcohol abuse, calling behavioral health, we lose more productivity in America to this disease than anything else. Like, in fact, what this metric is it shows you the number of days someone spends in a hospital and the number of days they live on disability. And you can see that we lose more human productivity to behavioral health challenges in America than we do to cancer and heart disease. And actually, when you compare us, I think I got bumped off there, so I'm going to share again. But I was trying to basically tell you that America makes us sick. And so let's actually look at the data. Between 2007 and 2017, twice as many young people were admitted to the hospital for self-injury. The number of days young people spent in the hospital increased by 50%. In California, we asked young people what's going on with them every other year in schools. It's called the California Healthy Kids Survey. And young people were reporting a 61% increase in mental health needs. And I think the clinical term is we suck. In California, we rank 45th in the nation in providing access to behavioral health screenings and care. And COVID did what everybody knows it did. But the reason I showed this previous slide is to not get it twisted. COVID didn't create the youth mental health crisis. A culture that equates fame with merit and wealth with value and is negotiating 400 years of structural inequality. That's what created the youth mental health crisis. Now, COVID made it a lot worse. It poured a bunch of gasoline on that fire. We saw emergency departments visits increase dramatically during COVID. We saw significant mental health related visits for younger and younger kids increase. And we got to the point where 1 in 4 young people, 18 to 24, said they seriously considered suicide. And when you take this sort of from the hospital perspective, one of the biggest children's hospitals in California is Rady Children's in San Diego. I have a bunch of really good friends who work in the emergency department there. And they saw utilization increase 1,700% from 2011 to 2019. So just to tell you what that means, Rady went from 3 kids a day in the emergency department for mental health challenges to 33 young people a day. And if you don't disaggregate this data by race, you're sort of missing the point. I'm suggesting, and I'm telling you that the data shows quite clearly that the crisis young people are living in is socially constructed. So if I spontaneously combust and you take nothing else from what I say today, I want you to join me in helping to think about mental health as a support for healthy development, not a response to pathology. And more evidence of the social construction of this crisis is clear when you look at disproportionate mental health challenges based on race or gender or identity. And in California, 81% of kids on Medicaid are children of color. The suicide rate is twice that for Black kids as white boys. 70% of children, if not more, have primary mental health challenges who are in detention. In fact, the single largest increase in self-injury was girls 10 to 14. So making our systems healing centered isn't just like tweaking a program or putting a therapist in a school. It requires acknowledgement of the social construction of what's happening and how racism and poverty impact young people and their families. So something's happening. Like, I don't know if you all are noticing it, but like everybody's talking about youth mental health in a way that we weren't just 4 or 5 years ago. There's federal action. Lots of states have initiatives California has invested up to $10 billion. So there's a new understanding that things aren't okay with young people. Young people have been telling us, adults haven't necessarily been listening, but there's now beginning to be a broader conversation. And Californians, when we survey them, say that this is among the most important issues, which is the mental health and welfare of their children. And we're finally starting to talk about this in ways that aren't just about pathology or diagnosis. Some of the work that Nadine Burke-Harris led around adverse child experiences, or the work of public health systems to identify the social determinants of health, we are at least beginning to acknowledge that individual psychopathology is not a good frame for what's happening with young people, but things like race and poverty are. And finally, we're about to spend a whole lot of money, like literally $10 billion in California. Lots of states have youth behavioral health initiatives. So there's money starting to flow in new ways. Unfortunately, we got to get it right. So to take advantage of this moment, you have to recognize that the biggest payer, people who pay for things, are managed care plans, meaning most young people are enrolled in a managed care plan that has a benefit that pays for mental health services. So we've got to get the managed care plans to do differently. We have to change how we pay and do, meaning not every young person wants or needs a 50-minute psychotherapy session with someone who doesn't look like them. And maybe, and this is the point of today's conversation, we can create new partnerships with our workforce and economic development partners and build a system for people, by people, a system that centers the wisdom and intelligence of lived experience, that sees young people as a solution, not a problem. And as I said, this can only be done if we break the medical model, if we reject the idea that the solution to the mental health crisis among young people is meds and beds. And what today's conversation is about, and I ask you this honestly and authentically, what if the solution to the mental health crisis is young people themselves? So what is this project? Peer-to-peer programs are actually an evidence-based practice from the Substance Abuse and Mental Health Services Agency of America, and they have named them for more than 20 years as essential to reforming our troubled mental health system. They are an efficient and effective care model that young people embrace. Young people say they want to hear from their peers about what's going on. And when you talk and interact with young people, you know that a lot of the kind of stigma of mental health is an adult construct. Like, young people are ready and willing to talk about what's going on in their lives. It's largely adults who carry the stigma that mental health is bad. Peer support complements the roles of therapists and case managers, meaning we're not saying that therapists are irrelevant. We're just saying that we don't have enough of them, we never will. And there's a different kind of service that is super important and evidence-based to support the health and welfare of young people. It has its roots in the recovery movement, and meaning that research shows that peer-to-peer support contributes to increased self-esteem and self-confidence, as well as greater hope and aspiration. And you don't need the studies I'm citing here. Like, when we are all struggling, what do? We talk to our friends, our family, our peers, and in the expression of our challenge, in the sharing of our experience with people who understand us, who care about us, we heal. And that's the essential practice of peer-to-peer support. Some of the evidence, and there's lots of more of this stuff on our website, includes decreased substance abuse, lower rates of depression and psychotic symptoms, and significant reductions in hospital admission rates. So what are we doing in LA? So the City of Los Angeles and its partner agencies acknowledged this data and research and reached out to us, who are doing a lot of work in this space, and asked us to co-construct with them a pilot in their 14 youth source centers. So the youth source centers are places where young people can go and get access to employment and training support. They're run by community organizations, and they're distributed around the city of Los Angeles. And we assembled the resources with the support of philanthropy and the city of Los Angeles to develop a concept that would provide hundreds of youth with the opportunity to become certified peer counselors and support their friends and other young people in the youth source centers. So the program goals are to hire and train 70 to 90 young people, train them and pay them for a total of 300 hours, make sure they can prepare and pass the statewide test that gives you certification as a peer counselor, and enhance the youth source center's abilities to provide direct support for young people who are struggling with social and emotional challenges. So in addition to training that happens through a combination of in-person and online, what we call synchronous and asynchronous, We also place young people in the youth source centers that they are connected to help other young people get the social and emotional support they need. What's really important is we linked this position to this new opportunity for certified peer counselors to bill Medicaid. And we haven't talked too much about Medicaid, and not everybody understands it, but basically the way to think about it is half of the children in America are covered by Medicaid. And disproportionately, those young people are young people of color. And so one thing that's important to hold about this project is peer specialists are a new provider type in Medicaid. And we are training young people not only to help themselves and each other, but also to access family-sustaining employment through reimbursement from the Medicaid system. So here are our partners. In the city of Los Angeles, you heard from Gerardo and Lisa, 2 of the major departments of the city supported us. West Coast Children's Clinic is our training provider. They have a long history in working with young people who are in the foster care system, in the juvenile justice system, and with sexually exploited children, and they have run numerous peer-to-peer projects across the state of California. Our local clinical support and lead is El Centro de Ayuda. The Los Angeles School District is a partner by placing school counselors in each of the youth source centers. The youth source centers themselves, the 14 community-based organizations, the Hilton Foundation, and the California Endowment, and of course, us, who are here to kind of design and work through the project, and the Public Works Alliance. So it's kind of complex. There's a lot of people involved, but the premise is pretty simple. When we get to scale in each of the 14 youth source centers, there will be between 3 and 5 young people who are trained and certified as peer counselors to help the young people who use the center and to move on and further their career in mental health. So let's talk a little bit about what the actual certification is. So when you are a provider in Medicaid, you have to consider a couple things. The first is something we call scope, which means what codes can you bill, where can you work, and under whose supervision? That's called scope of practice. You also have to consider credentialing, meaning how do you become a certified peer counselor? What tests you have to take, what classes you have to take, what curriculum must be approved. Handling means how do you sign up to get paid? Payer means which of the various components of Medicaid pays for you. And finally, what are the rates? Are they enough to make a living on? And in California, but across the nation, there's been this dramatic expansion of new types of providers in Medicaid, in part because there's never going to be enough therapists. Even if you wanted to give every kid a therapist, there won't be one. There's just impossible. But also because we don't think that's the right model of care, and that young people can heal themselves and each other if we give them the chance. So in California, we created community health workers, doulas, peers, and wellness coaches. And the one we're here to talk about today is the certified peer, which is one of the 4 new provider types. So let's try to put those provider types in context for you, because whatever state you live and work in, some version of this is happening. So if you're a young person in high school and you're working as like a peer health educator, maybe you're making $50 a month talking to other young people about life and the challenges of being young in this culture. And I have been involved in literally hundreds of these types of programs, and they work great. But if you're that young person, you're a 16-year-old in a high school working for your school-based health center or working for a local not-for-profit, talking about these issues, the idea that you would become a therapist means you have to go to college, you have to go to grad school, you have to do your internship and training. It's literally a 10-year journey, and that was too far. So one way to understand what we're doing is we are now saying to those young people in a high school who are interested in helping other young people or becoming a therapist someday, they can graduate and become a peer specialist. Then they can become a community health worker. Then they become a doula if they want to be interested in birthing. They could also become a wellness coach with an associate's degree or a wellness coach with a bachelor's degree. They can now become an intern and bill Medicaid. And finally, they could be a licensed therapist. So if you can see the strategy behind this work is the foundation of it is a belief in the wisdom and power of young people to help each other. But it's also carefully articulated to the reform landscape that is trying to address the youth mental health crisis and the idea that we must democratize the delivery of mental health services. Make it not just about the hospital and the doctor's office, but wherever you live, work, and play, you should be able to access trained support to help you navigate this toxic culture we've built. And remember, it's not you, it's us. We have built a toxic culture for young people. We must now teach young people how to survive and thrive in it. So just looking at the way these new provider classes also get paid, if you look at the bottom of this slide, you'll see the sort of rates that happen. And basically, you could start at $16 an hour and get paid to train in our project for the certified peer demonstration. But if you're a CHW, you can make between 40 and 55K, wellness coach up to 65K, wellness coach 2 up to 83K. If you're an intern or associate with a master's degree, you make almost 100K. And once you're a therapist, you make between 100 and 155K. So what are the expectations of this work? We were looking for young people who have a desire to support each other as they navigate life's challenges, and they have a curiosity about the helping professions. Because this isn't like something you do on the side. This is a professional opportunity to build your skills and support your family. The training period includes up to 10 hours a week of virtual training, and you have to have access to an internet and computer because we're training young people from across the nation state of Los Angeles. The work period is January to March, and then the practicum or the actual support for other young people is March to June. So think the whole project is January to June. It's about a 6-month training and practicum experience, at which point, when you graduate, you can apply for employment with the Department of Mental Health or other community-based organizations. Peer advocates will design and facilitate group workshops with other peers. These will include topics of substance abuse, conflict resolution, getting access to care if you need traditional clinical support. And they'll also hold drop-in hours for peers so young people can have someone who shares their life experience to come in and ask about what's going on with them. They will help connect peers to case managers and PSAs, which are school counselors, if they need additional support. And they will support those case managers and PSAs as part of the care team to help young people who are struggling. At the youth source centers, peer advocates will not provide clinical services because they're not therapists. But they will make direct referrals for services and understand how to help young people who need greater support than what a peer can offer. The curriculum topics that peers will be trained in so that they can support other young people include communication and listening skills, group facilitation, conflict resolution, substance abuse treatment and recovery practices, harm reduction, ethics and boundaries, confidentiality and reporting responsibilities. If you hear something that amounts to child abuse, you must report it. Cultural competence, safety and crisis planning, how to navigate the system if you need more than what is available, and some others. But these are the essential modalities or benchmarks that you must be able to demonstrate proficiency in when you take the test for a certified peer counselor in the state of California. So the players are El Centro de Ayuda is a mental health provider who will support all 14 sites and the young people in them. So if the young people either get triggered from something they hear that activates their own challenges, they will have access to master's level support. And they're also the project manager at El Centro will support all 14 sites in the design and development of the peer-to-peer group sessions and individual case managers. West Coast Children's Clinic is our curriculum designer. We had to write the curriculum, take it to the state, get it approved, and we're now almost finished our first cycle. And Youth Source Center staff, we had to train and orient each of the Youth Source Centers about how to make this experience positive and beneficial, not only for them as a center, but also for the young people doing the work. And we're super grateful for the Los Angeles Unified School District, who has placed school counselors in each of the 14 youth source centers. Those school counselors will provide clinical support as needed, but also are part of the milieu or creating a community of care in each of the youth source centers. So what's the project timeline? It took us, it even took us longer than this. September to December in 23 was our project development, where we applied for money, we've got the curriculum written, we trained the youth source centers. We basically did all the necessary pre-work to launch the project. We had to adjust all of the contracts with the youth source centers so that they could pay the young people. There's a lot in this that Gerardo's team and Lisa's team did to make it even possible for the project to move forward. Our demonstration pilot, which is our very first cohort, about 15 young people, are in their last little bit of training. And their work period at the youth source centers just started and will run through June. These are the 200 hours of direct service. And then we will go live with a full program beginning in July, where we'll have our second cohort, 50 to 70 youth. We've got some changes we need to make. We didn't get it all right. We got some things we need to improve, but we're super grateful for the young people who helped trailblaze this work. And we're excited to launch at scale this summer. So I'll stop and take some questions. I think I'll drop the PowerPoint so I can see folks. Thank you for listening, and we're super excited about this work.
So first we'll take some questions from the youth panel. Would anyone like to start? Yeah, sure, I can go first. So essentially, I was just wondering about like the youth involvement in the progress of developing this project. You mentioned the focus group. I was wondering if there was like any youth development or youth input in terms of the focus group, or as you went along, how the youth helped consult on some of the decisions that were made.
Yeah, so my organization, the California Children's Trust, my board is 12 young people, and this project was born with them. So Nia Do and Sriya were our project leads for our peer-to-peer project, and they actually created the peer-to-peer demonstration project for high school students in the state of California. So I can drop some of the papers that they wrote. So the movement that created this opportunity, SB 803, was designed and developed by young people, and our organization is literally accountable to the 12 young people who are my bosses.
Yeah, I would add to that. I mean, I think there's a number of opportunities for youth to provide input into this program. Lisa, who spoke earlier but had to drop off, her department oversees a citywide youth council, right, that help inform this program, help provide, and provide the impetus, right, for why we took this on. Alex also mentioned the 14 youth source centers. They each have their own youth council that provides input into all of the programming that occurs at the 14 centers.
So, hello again, great to see you both. And I was a wellness coach in grad school, and it was an amazing time. I really appreciated the work that I was able to do with that, and saw firsthand just how impactful it can be. And I also saw some of the challenges that came with kind of knowing when my role began and when counseling began, or where that cutoff was, and especially for the clients that I would work with. So I was curious if you could share with us any information you have on kind of like the escalation protocol that you have in place for this program to ensure that the peer supporters are kind of staying within the scope of their responsibilities and kind of minimizing this from becoming counseling. I know that's like a huge concern and pushback that a lot of these peer support programs get, so just curious if you could share a bit more into that process and protocol.
Yeah, thank you, Brandon, for that question. So it's really important to differentiate what a peer support specialist does from a clinical service or support. So a peer specialist cannot work alone. Like, that's this thing called scope of practice. They must be supervised by a licensed clinician. So first, the work, what they're trained to do is not clinical in nature. And you use the term escalation protocol, which is a good term. But for every 5 hours of interaction with a young person, they must review what they do with a licensed clinician. And then, the navigation and brokerage training that we do is basically about how to identify risks for self-injury, role and responsibility. So it basically has a very specific set of triggers for when you have to refer up and out. I think it's important. This is an important point, Brandon. So I don't want to demean or diminish it in any way. And I want to say that young people are always talking to each other about what's going on in their lives. Like, that's a function, like, that's happening. And what we're trying to do here is inform that with, clinical training and support and access to someone when they need it. So on the site is not only a master's level school counselor, but also the role of El Centro de Ayuda is to be there for just this circumstance. for when a young person encounters something that is outside their scope.
Great, thank you.
I have a question. Thank you again for your presentation. It was so amazing, and you really touched on a lot of the points that we had gone over previously. But just in case you didn't cover this, you said that the West Coast Children's Clinic is the curriculum designer of the peer specialist training. And I was just wondering if that curriculum goes through any youth approval, or if youth are involved in giving feedback or commenting on the curriculum before it's officially sent out.
Yeah, that's a good question. No, I cannot say that any specific young person reviewed the curriculum. It has to go to a state agency called Cal Mesa, the California Mental Health Services Association, and this is the statewide entity that approves the curriculum. So Kira, it's a good question, and I cannot honestly say that any young person put their eyes on the curriculum before it was approved.
Thank you.
Thank you for your question.
You mentioned things like productivity and workforce partners a couple of times. I was curious if that is going to be used to measure outcomes, or how otherwise you will be evaluating the effectiveness of this peer-to-peer support. I am a big fan of peer support myself, so I think this is great work, but I'm wondering when it comes to evaluation and improving this program going forward, what that'll look like.
Love it. So the classification, this thing called a certified peer counselor in California, is brand new. So the economy, meaning like the opportunity for direct employment, is still emerging. But what's fascinating is we had this extraordinary meeting with the Department of Mental Health in Los Angeles, who basically said they'd hire everybody we trained. So I think it's hard to say. So, well, then to answer your question directly, Ray, like every single young person we train who wants a job, we want to get them one. And so that's absolutely a metric. Yes, like not only did you get trained, not only did you help other young people, but if you want to go a job as a peer support specialist, we want to make sure that that happens, and that will be a way we measure our effectiveness. And we weren't sure when we started this project what the employment opportunities were going to be, and we are been very pleasantly surprised with the interest of employers to engage with us.
Yeah, to add to that, so ultimately this is still a workforce development program for the city of LA. So we do, there's a number of measures that we typically use to evaluate programs. So including the number of youth that got a job after participating in the program, and the wages. So Alex did mention, our recent conversation with the Department of Mental Health. Not only are they offering to hire these individuals, their starting wages will be in like the $50,000 to $70,000 a year range. So, again, this is for individuals without a 4-year degree, making, upwards of, $70,000 a year. In Los Angeles is just, an amazing just achievement.
Hey, I just saw a question in the chat, which I think I inadvertently dismissed, but whatever state you're in, 48 states have a certified peer counselor of some kind. California was actually the 48th. This work actually began in Georgia in the 80s. So whatever state you're in, there is likely a certified peer counselor mechanism, or at least in 48 of the states. And so I think the question in the chat that I dismissed accidentally was, does New York have one? And yes, they do. But if you remember those considerations I put out there, when you look at your peer certification for peer mental health services in your state, you will find that you have to be 18 to get paid by Medicaid. And then you want to ask yourself those questions that were in the slide. What scope? What codes can you bill, and under whose supervision? How do you become one? Credentialing. How do you sign up to get paid? Who pays you? The state, the managed care plan? And then finally, what are the rates? Meaning, are they workable? So thank you for that question in the chat.
I guess another quick question I had was just about the focus of the peer specialist. You mentioned how it was the 48th in the country. And I know in like different states and different regions, each peer specialist program has their own focus or sub-focus, whether it be substance abuse, mental health education. So just wondering if the one in California had a specific sub-focus in that was introduced by youth or emphasized by the youth to have?
Yeah, it's such a great question. Thank you, Mohammed. Some states have a number of different kinds of designations, like a peer support for youth, or peer support for drug and alcohol, or peer support for parents, like parent partners. So you'll see every state has a little bit of a different flavor to the way that they organize it. But yes, there are peer support specialists with a specific youth designation in both Georgia and California.
Oh yeah, I had another question as well. So I was curious, since this is focused on kind of like work, professional development opportunities and everything, if you could share a bit more information into what does that, I guess, look like in terms of the conversations around exploration of additional careers for engaging in mental health work, and also if there's any plans to provide that support for some of the additional barriers or overcoming some of the additional barriers that come with getting into this field as well. There's sometimes like hidden cost or all these other factors as well too. So curious just how to remove as many barriers as possible to make sure that this is as feasible for the youth to continue on with this.
Brandon, I love that question. Thank you so much. So first is money. Like, that's why you'll notice that the young people make $16.72 an hour, whether they're training or doing their practicum. So it was essential that the project included enough money to pay your bills and show up every day. The second was wraparound support, including whatever it is you need to show up and be present for other young people. And the third is a clear understanding and mentorship from people in the field. So that's the school counselor from LAUSD, El Centro de Ayuda from West Coast, and from us. And what we've discovered is that a lot of young people don't even know that this is a thing, that this is a career. So what I would say is like this clear, the teaching of the pathway, that you can get a job helping other young people, and that it's a pathway to a $150,000 a year job. That slide I showed with the path. So teaching, and then ensuring that young people get their needs met, because you can't heal if you are struggling with your own dramas. So the project has a very specific focus on the wraparound supports necessary to support young people to get through the 5-month program. And that includes direct personal counseling, case management, money, and wraparound supports.
Yeah, appreciate that. And a quick follow-up on that as well. You mentioned how a lot of investment has gone into youth mental health support and services and everything. So I'm curious if there's any strategies that are currently in place or being planned for to make sure that this isn't just a period of investment into this field and topic, but it's something that is a continuous investment because, yeah, you got to follow the money a lot of times, and that really shows where the priorities lie. So I'm just curious if there's a way to assist as a permanent priority.
Yeah, Brandon, man, that is the heart of this whole thing. You just nailed it, which is the economic benefit of the systems that serve poor people isn't deriving to poor people. Like, there's a whole professional class of people who make their living on helping poor people. And this project is about shifting the economic benefit of Medicaid to the people it was intended to serve. So this project is exactly that, is to structurally change who does the work and who gets paid to do it. And the way we describe that is the shifting of agency and power. Agency is defined by who does the work, power as defined by who gets paid to do it. So you guys are breaking up on me on the screen a little bit. I hope you can hear me. But my point on this one is, like, I have worked in these systems my entire life. Like, I led a system with 10,000 employees, and the people who worked for me didn't look like the people we served. And what we need to do is reimagine who gets the money and who does the work. And that is the best way to engineer in long-term the economic benefit shifting from the professional class to the beneficiary class. Thank you so much for that question, friend. That is exactly the point of this entire project.
Happy to have asked.
Okay, I think now we can take questions from the audience, online or in person.
Okay, I have a question in the chat online. Laura had asked, had talked a little bit about in New York State, peers are supervised by other more experienced peers. That's how they have it set up there. And the question of, is LA County looking to create the designation of peer support?
So yeah, California created it in 2022. We are looking to act on it. And the innovation here is the use of workforce dollars to reimagine the workforce for youth mental health. So like that's the creativity here, but the certified peer counselors were created in California in 2021 or 2022 through something called SB 803.
With that, Alex, are you looking to create a youth peer support designation specifically around this project?
Yeah, that is actually in the legislation, but it hasn't been operationalized yet. So yes, that is a long-term goal of ours.
Hello, I also have a question for you. As somebody who my roots began in peer support, I just have a question for you. I know you mentioned a lot of the young people you work with were formerly involved in juvenile justice, foster care, different systems like that. I'm just wondering what kind of practices you implement to kind of avoid tokenization of these populations and any sort of restorative justice practices or anything you do in specific that kind of navigates those things that we see in this work quite often.
Yeah, I mean, our fundamental belief is that young people can heal each other and themselves. And so we don't think that's a token, we think that's foundational. And basically, we would like to see the workforce system align around the healing arts and move away from things, traditional investments in the culinary arts and security. And not that those careers are negative and bad in any way, but that there's a whole world of young people who have lived through adversity and can share their wisdom and experience with each other. And so that's the purpose and intent of this project. So we don't consider it a token, we consider it a foundational systems change in workforce development practice and in workforce development in youth mental health.
I love that. So what are the actionable things that you guys do to ensure that that's done differently? Because a lot of places we see it not that way. So we'd love to learn kind of from you, what are a few things you've implemented to make it different for you?
Yeah. So we place young people in the context of community-based organizations where the staff look like them and reflect their lived experience. So those are the youth source centers. So first of all, we don't place them in a hospital with, a white professional class. Second, all of our training staff are people of color who are expert in youth development and leveraging the wisdom and intelligence of young people. Third, we hired a culturally concordant and congruent project manager, El Centro de Ayuda, who is both fluent in Spanish, but has made their living and career working in marginalized communities with mental health and social justice integrated. I think that's it. We make sure we pay young people because their time is precious, and they deserve and earn it. And then I think we also are very careful about ensuring that they have access to people who look like them, who are in the professions, who have master's degrees, who are working in youth mental health. So that I think those are our strategies. But of course, welcome any feedback if for additional ones.
We have one more question in the room.
So maybe you may not have the answer to this, but because it seems like that your project is just in the LA city area, how are you including youth in rural and outlying communities?
First of all, what I'd like to do is say that I think that there's an interesting movement occurring. Right now, it's largely being held by technology vendors and private equity. So I think Brandon mentioned that he had been a wellness coach. There's an exploding world of for-profit entities who are creating coaching apps for young people using phones and technology-enabled modalities, and they are proliferating in rural communities. So there is something to it, so I would like tell folks things like Do Somethings or Appa Health are examples. And I think there is a growing sort of willingness and interest in leveraging technology to address some of the geographic challenges for rural communities. It's just I have some distrust because of the actors largely in the space are for-profit companies, technology companies who are developing these models. But I likely think that the solution to these distributed models of social support will be technology enabled. Again, I just have some questions about the current actors in the space.
Thank you very much for that presentation. I think it's very powerful and inspiring to find a solution to the epidemic. You mentioned it's a disease, and I completely agree with that. The mental health crisis among youth is an epidemic now across the United States. I remember I saw a statistic the other day that last year about 25,000 college students attempted suicide, which is an outrageous number, outrageous figure. So I appreciate you and your organizations that are working to not only bring a solution to youth, but having youth at the forefront of this solution and helping their peers in need through this peer support training. I think it's very necessary because oftentimes when youth are struggling or are in crisis, they turn to their fellow youth and peers. So I think this is an amazing solution, one that is very much needed and one that will help protect a lot of people. So I thank you again and all of the presenters and everyone who worked on this initiative. Thank you very much.